Greetings and welcome. We are just giving it a moment for folks to join us. Welcome everyone to the Vital Village Networks of Opportunity for Child Wellbeing 2022 webinar series, Levers of Change in Action, Unpacking the Now Playbook. We are so excited to kick off this amazing series. I'm Renee Boynton-Jarrett, the Director of Vital Village Networks, and I am now going to turn it to the incomparable Ronda Alexander, our Director of National Partnerships, to start us off.
Awesome. Thank you so much, Renee. Welcome. As Renee said, I'm Ronda Alexander. So excited for this three-part series where we'll hear from Now Network leaders and others who are applying the levers of change outlined in the Now Playbook and in their communities. To kick off this series, we'll hear from two phenomenal leaders who are working to build equitable and resilient food systems at the intersection of maternal health and justice. As we begin our time together, I'd like to acknowledge that we are continuing to strengthen our language justice practices. And this webinar series will be in Spanish with interpretation services provided by the Community Language Cooperative based in Colorado. I'd now like to turn it over to our interpreter, Astrid, for a moment to give us some instructions.
Thank you so much. Hello, thank you so much for having me here today. My name is Astrid Arroyave and I am with Community Language Cooperative, and we are opening up spaces for language justice, which means that people can talk in what we call the language of our hearts, the language in which we can express ourselves the best and the one with which we feel the most comfortable. We are going to do this through simultaneous interpretation. I would like to share with everyone a few guidelines to support language justice and simultaneous interpretation today. Please, let's remember that Spanish is 25% more extensive than English. So let's keep it a comfortable pace so interpreter can keep up with your message, like a conversational pace. If interpreter brings out her image and does this sign, it's saying to please elongate what you are saying and slow down. This sign means that the sound is not good enough for interpretation. And this sign means to as asking to please talk one at a time, please. Once I finish this small intro that I'm going to repeat in Spanish as well, and once the interpretation function is turned on, you are going to see in the bottom of your screen the globe icon. You can click on it and you will be able to choose the channel of your preference, English or Spanish. Also, you will have the option of muting the original audio so you don't have to hear two languages going on at the same time. And last but not least, when you are not talking, please mute your mic. Now I'm going to say this in Spanish. Hola, muy buenas tardes. Mi nombre es Astrid Arroyave. Muchísimas gracias por tenerme aquí el día de hoy. Estoy con la Cooperativa Comunitaria del Lenguaje y soy su intérprete. Esto lo haremos a través de la interpretación simultánea. Me gustaría compartir algunas pautas sencillas para apoyar la justicia del lenguaje y la interpretación simultánea. Recordemos que la justicia del lenguaje nos ayuda a hablar en el idioma de nuestro corazón, es decir, en el que nos encontramos más cómodos y con el cual nos podemos expresar mejor. Para apoyarlo, recordemos que el español es 25% más extenso que el inglés. Así que, por favor, tengamos un ritmo cómodo al hablar para que la intérprete pueda seguir todo el discurso como un ritmo de conversación. Si la intérprete trae su imagen y hace este símbolo, le está pidiendo al orador que por favor alargue lo que está diciendo y vaya un poco más despacio. Este símbolo significa que la intérprete no puede escuchar suficientemente bien para realizar la interpretación y este símbolo quiere decir que por favor hable una sola persona a la vez. Una vez yo termine esta pequeña introducción y se encienda la función de interpretación, ustedes en la parte de abajo de sus pantallas verán el símbolo del globo terráqueo. Hagan clic allí y allí podrán seleccionar el canal de su preferencia, inglés o español. También tendrán la opción de silenciar el audio original para que no tengan que tener dos idiomas al mismo tiempo. Y para terminar, cuando no estén hablando, por favor silencien sus micrófonos. Y esto es todo. Muchísimas gracias y ya podemos encender la interpretación. This is all. Thank you so much. And we can turn on the interpretation function right now. Thank you.
Thank you so much, Astrid. I want to make sure we have a moment for turning on our language. Wonderful. For today's, so I just want to share a few housekeeping reminders. As I mentioned, our language justice is being provided by the Community Language Cooperative of Denver, Colorado. Today's webinar will be recorded and posted on the Now Innovation Forum within the next few days. Also, we encourage you to engage with us throughout today's webinar by sharing what resonates with you in the chat box and submitting questions through the Q&A icon at the bottom of your screen. Our guests will also have an opportunity to respond to some questions later in the hour. So while we are only here for 1 hour, it will be a powerful hour. We'll share a brief overview of Vital Village networks and the networks of opportunity for child well-being, followed by an introduction of the Now playbook. We'll then hear from Tonni Oberly and India Hinton, and later you'll be able to pose questions to our guests before we wrap up with a few announcements and some upcoming opportunities in our closing. So while many of you have been with us for a while, I'd like to welcome those who are joining us for the first time and offer a very brief overview of Vital Village Networks and Now. We are a collective of changemakers committed to pioneering sustainable approaches to transforming child, family, and community well-being. We are rooted in Boston with a broad web of peers and partners across the country, all connected through the networks of opportunity for child well-being, better known as Now. We are all bonded through our guiding principles of creating shared spaces for belonging, engaging, and transforming our communities together. To hear more about our work and to share your own stories, we invite you to visit the Now Innovation Forum, where you'll find access to a variety of tools, resources, and stories of leaders working collaboratively to shift what it means for our children, our families, and our communities to thrive. If you have not yet had a chance to download a copy of the Now Playbook, I encourage you to visit the forum after this webinar to get a copy. The playbook is designed as a living guide to what it means and how it looks to transform community capacity to advance equity. It can be read as a book or used as a reference tool. Either way, it's meant to be read and reread as often as necessary. It's based upon 5 levers of change that we have found to be integral to community-led change: centering racial equity and healing, implementing shared governance, engaging communities authentically and with dignity, data storytelling, and planning for sustainability. The playbook features stories of what each lever looks like in action from communities across our vast network, key strategies from the village, and helpful tools and resources. Throughout this series, we'll hear from change makers whose work embodies these levers of change in various angles or from various angles that focus on uplifting and supporting children, families, and communities. So now that you've been oriented to Vital Village, and now I'd really like to transition us to hearing from our speakers, Tonni Oberly and India Hinton. Their bios and links will be shared in the chat or a little later. So I encourage you to explore those after our time together. And one last thing before we do that, we're trying something a bit new with this webinar series. So we invite you not only to listen, but also consider what you're hearing and what actions you might take to advance your own work. So following this session, you're going to receive a reflective action guide for your personal use to help you unpack what you've heard and how you might apply it to your own practices. And this guide is available in Spanish and English. So without further ado, I'd like to welcome research scholar and member of the National Birth Equity Collaborative, Tonni Oberly, to share about how she's working at the intersection of equitable food systems and maternal health. Thanks, Tonni. Welcome.
Wow, wonderful. Thank you so much. Hello, everyone. My name is Tonni Oberly, and I'm a research scholar at the National Birth Equity Collaborative. I want to thank the Vital Village Networks and the NOW team for inviting me to this amazing event. I'm excited to be here to discuss the intersection of food justice and reproductive justice with you all. I am presenting from Urbana, Ohio, which is the indigenous lands of the Shawnee and Hopewell. So on the next slide, I want to give a quick introduction to myself. I think you skipped over one. Yeah, there we go. Thanks. So I consider myself to be multifaceted, as we all are. I kind of took a meandering path to come to work in this intersection of food justice and reproductive justice. I'm a research scholar at MBEC, the National Birth Equity Collaborative, where we center the experiences of Black birthing people as we move towards reproductive justice. I'm also a third-year PhD candidate in city and regional planning at The Ohio State University. I'm a trained doula and a certified lactation consultant, and I'm a beginning farmer where my husband and I use regenerative agricultural practices, pulling together our experiences and knowledge in sustainability, community development, and public health. I came to this work by taking action in the ways that I could in response. I'm still on the other slide. Thanks. In response to the new information that I gained. So I went to Emory University and double majored in biology in women's gender and sexuality studies, focused a lot on sexual health research. But when I moved to Ohio, I learned about the dismal Black infant mortality rates and the inequities there. I did my master's in public health and worked in maternal and child health research at the state health department, as well as at a research center at a university. But I was often frustrated with such a downstream focus on individual behaviors and not thinking systematically. So this led me to look at fields that were focused more on social determinants of health. And I landed in city and regional planning, where specializations like housing and food, transportation, community development, and the built environment are those specializations where we can kind of more directly impact health outcomes. At the same time, my husband and I decided to start a farm to sequester carbon in the soil through regenerative practices in response to climate change. And I keep going in this work because I truly believe that it matters. And I believe that we can all make a difference. And I do this work for my family, my friends, my community, and myself as a Black woman. We can go to the next slide. So on the next slide, I want to highlight the definitions of reproductive justice and food justice so that we're on the same page. Sister Song defines reproductive justice as the human right to maintain personal bodily autonomy and have children, not have children, and parent the children we have in safe and sustainable communities. And Foodprint defines food justice as a holistic and structural view of the food system that sees healthy food as a human right and addresses structural barriers to that right. So we can quickly see that reproductive justice and food justice are based on a human right to flourish. And we must address structural barriers to achieve both of these aims. So on the next slide, I want to spend just a little bit of time drawing the connections between reproductive justice and food justice. Although if you're here, you may already be, I might be preaching to the choir. But I had an opportunity to create an op-ed with my colleague, Kelly Davis, and we were drawing out these important connections. So some of the leading causes of maternal mortality and morbidity are driven by increasing numbers of pregnant people with chronic diseases, such as hypertension, diabetes, heart disease, iron deficient anemia. And if you pause, you realize these are food issues. And most health outcomes are not determined by healthcare. Although the United States spends an unparalleled amount of money on healthcare, the United States has the worst maternal mortality rate of any high-income country. And Black moms and moms of color, especially Black and Indigenous mothers, are bearing the brunt of this inequity. But we have to think systematically and not at the individual level, as is often the approach in our systems. So a litany of racist policies and procedures have limited access to healthful foods that can help prevent or mitigate poor birth outcomes. From access to land and capital for Black farmers to economic disinvestment via redlining policies, the United States government has actively hindered access to healthful foods in neighborhoods of color. Great, okay. And yeah, the op-ed was shared in that link, so thank you for that. So as we go to the next slide, I want to highlight that if we use a place-based perspective, you can see how policies have shaped both of these intersecting crises. So on the left, you'll see a hotspot map of Ohio. This is in Columbus, Ohio, which is close to where I am, of infant deaths. And you can see the areas that are red and yellow, that's where they're the highest. And on the right, you see in the same location, areas showing low income and low food access areas. And even at a quick glance, you can see that these are overlapping areas. So while we are often siloed between people working in food justice and reproductive justice, these maps show that we are really dealing with the same issues in the same places. So we really need to think about what is the underlying cause that we're having these same issues, or different, perhaps we think of them as different issues, but we're in the same places having the same issues over and over. And I think that if you looked at any other issue that you might also be concerned with, poverty, education access, you're gonna find it's the same places again in your communities. But what I believe and what data has shown is that what unites these movements is structural racism. So if we go to the next slide, here you'll see a web of causation that links structural and social determinants of health to poor health outcomes. And this was developed by Jessica Roach at Root, or Restoring Our Own Through Transformation, which is a doula collective in Central Ohio that I was a part of. But if you look, you'll see food stability linked directly with infant and maternal mortality. But you take another step back and you see all of these other issues are also connected. So all of these social determinants in red that we're all probably quite familiar with. And then these structural determinants in these blue boxes are upholding these social determinants. And these are foundationally structural racism. So we have to take a step back and address these structural issues and how they impact our social determinants. And then we will be able to move towards better outcomes. So if we go to the next slide, I know that we here all want to be really action-oriented. So lastly, I just wanted to quickly share my theoretical framework for addressing structural racism. I often hear, this is going to be too hard, it's too big, but we can do this, and we are doing it, and we have been doing it. So if you remember, in the summer of 2020, jurisdictions across the United States were declaring racism to be a public health crisis or emergency. So I propose, why don't we actually treat it like an emergency then and use an emergency recovery framework to address structural racism? So here I just show how the National Disaster Recovery Framework can be applied to thinking and acting to address structural racism. The National Disaster Recovery Framework has 8 recovery core capabilities, which you'll see on this slide and the next slide. But they are planning, public information and warning, operational coordination, economic recovery, health and social services, housing, infrastructure, and natural and cultural resources. And notably, all of these have been and continue to be impacted with inequities perpetuated by structural racism. But we can also use our levers here in each of these categories to impact reproductive justice as well as food justice. Because if you remember that web, these are all connected. So while I listed food justice under infrastructure here, we could just as easily think about approaching food justice from an economic perspective, right? Like, this is jobs, there is money involved in food, and right now it's very concentrated in large companies. But what does it look like for us to be generating income and revenue in our communities through healthy food that not only benefits our health, but our economic status and our connection to each other and our connection to the land? So I propose this framework just as one actionable way for us to address structural racism and recover and move forward. So finally, you may be familiar with beloved community. It was a term popularized by Dr. Martin Luther King Jr. And it's a community in which people, when everyone is cared for, it's absent of poverty, hunger, and hate. So Dr. King believed this was possible, and I also believe that it's possible for us to have that beloved community. And I think doing the work in both reproductive justice and food justice and understanding that they are actually intersecting movements that are both upheld by structural racism. If we bring our work together and really work to uproot structural racism, we'll move towards communities, that beloved community that is centered on justice, abundance, and love. So anyways, thank you so much. I welcome questions, comments. I hope we can connect, and I'd love to discuss more. Thanks so much.
Thank you so much, Tonni. We're so excited to hear a little bit more from you during our Q&A session in just a little bit. It is now my pleasure to introduce maternal and child health advocate India Hinton to continue our conversation. And then following India's remarks, we'll share some of the questions posed in the Q&A for both of our guests. So feel free to continue to share and post in the Q&A. And India, welcome.
Thank you so much, Rhonda. Good afternoon, everyone. I would like to start by thanking the Vital Village Networks and the Networks for Opportunity for Child Wellbeing, and also thank Tonni for highlighting the connections between food justice, reproductive justice, and maternal health as we delve into this community conversation. As Rhonda mentioned, my name is India Hinton. I am a licensed dietitian nutritionist by training and a maternal child health advocate. I was led to this work of food justice and maternal health equity through my own personal journey with food and the influence that food had on both my physical and mental health. Earlier on in my career, I was in cancer research and I worked at Johns Hopkins University. And I really didn't have a balance between holistic wellness and nutrition. And so that led me to the field of nutrition and integrative health. From there, my journey made its way to Mama Toto Village, which is a perinatal health support organization that is located in the District of Columbia. And Mama Toto Village serves Black mothers throughout, like I said, the District of Columbia and parts of PG County, Maryland. The work there is really built on a home visitation approach where moms are provided a care team that really helps them navigate their wellness journey and pregnancy journey, starting with prenatal and ending in the postpartum period. You know, my work there at Mama Toto Village as the health and wellness coordinator really spearheaded my passion for community food systems and its influence on maternal health. It was at Mama Toto that I was able to identify disparities such as food accessibility and food insecurity, and really address these barriers through an equitable lens to ultimately define how these disparities played a role in the health outcomes of the mothers that we served. Next slide, please. I invite you all to take a minute to review and digest this image with me. And it's really, kind of a lead from the web that Tonni mentioned earlier, as we continue our conversation today about the tree of change. I named the tree of change. And here, this is the way that I really visualize and make connections through what we call a word cloud. And I titled this image, The Tree of Change, to represent the ways that we can influence change as we think about pathways that lead to equitable transformation and alignment of community systems. So I started the root, which is at the bottom of this image, which is the foundation to what will eventually grow into a vibrant and fruitful product, such as the tree that you see here. Similar to the web that Tonni mentioned earlier, we have the foundation and the root causes of, systems change, dismantling inequities, centering Black voices, centering community voices, addressing trauma, addressing, the need for equitable food systems, and really eradicating racism as ways that we can influence the positive and vibrant growth of communities, of sustainable food systems, of healthy families, of improved child outcomes, improved maternal health outcomes, lower ACE scores or adverse childhood experiences, building generational wealth, and having true racial equity. And so, once we tackle these root causes at the bottom of this image, we can really lead to better community outcomes, as mentioned. I believe that wellness is a holistic state of mental and physical well-being. And to eat well is to eat to thrive. And historically, the Black community has been deprived of healthy food options. And these options or this deprivation has really led to food access, to issues of food access and food accessibility. And these nourishing foods that have been considered a privilege in our society for decades has led to really, the main diet-related health disparities that our communities have faced. And so in order to address these disparities, we have to understand what really contributes to and ultimately what can eliminate the onset of disease. And that is by shifting the blame from our own communities, within our own communities, and look at outside factors that have blocked us from living well. And so the key takeaway from this is systems change. And so I want to leave you with this image for a second, just to digest it and keep it in mind as we continue our conversation today. Thank you, Rhonda.
No problem. Thank you so much. Thank you so much, India. So as we transition to the Q&A portion of the agenda for our participants, I invite you to continue to share questions using the Q&A button at the bottom of your Zoom menu. We will take as many questions as we can, so feel free to add, and you can also add comments in the chat box. So for now, I'm actually going to turn off our screen sharing and take a moment to maybe start with a question or two of my own, and then we'll come back to some of the questions that are starting to come in. So I know both of you talked about this a little bit, and you shared an introduction of sort of what brought you to this work, but I'd love to ask you, what keeps you going in this work around sort of the intersection of maternal health and food systems? And both of you can take a moment to answer. What keeps you going in this work?
Start really quick. I think that, through my experience working at Mama Toto Village, I was able to meet so many great community members, so many influential mothers and families and children, as well as my colleagues that I worked very, very closely with to help, our moms through our work. And it was really the moms that I built long-lasting relationships with and their stories that keeps me going every day and keeps me motivated to move forward in this work. It's where I started. It's where my passion grew deep, and it's what led me to really think about policy work as a means for systems change. And so I'm very grateful that I have been able to work closely with these moms who have experienced the issues with community food systems and racism through health inequities as well as food inequities, and really grateful for that experience. So,
Tonni, what about you?
Sure. I would certainly echo what India shared about those relationships and how important it is when you really connect with families and understand stories and just understand people and community. I would also say, I take this work very personally as well. I think that reflexivity is important, that I identify as a Black woman. So if I'm hearing what Black women are experiencing, then I say, we deserve better, and I want to be part of making it better. I think about my grandmother's experiences as a pregnant Black woman in the South. She, stillbirths, infant mortality in my own family, and it's things that don't get talked about a lot in families, but these things are generational and they've happened. My mom had difficult pregnancies, family, there's so much that is also like personal. And so I do this work. I said, you know, I do it for the community and I do it for my family, but I do it for myself too. And I want better for myself. I want better for the next generation. And I believe it's possible. So I continue to do it. I feel that I embody, you know, I'm living in my body and I want it to be well. So it all matters to me personally. I think, you know, rainbows are nice, you know, all of the like squishy feelings and community, but like legitimately, I want this to be good for me too.
Absolutely, absolutely. So we are starting to get some questions in the chat and in the Q&A. So I'm going to start jumping to those, and we'll come back to some other questions if I have them. So this question comes from Malia. It says, in what ways are parents and community members engaged in and leading in the work of the National Birth Equity Collaborative? So Tonni, I believe that one's for you.
Sure. Thank you so much for that question. And I know that the link to MBEC was shared, so there'll be more information there, but I could highlight there's quite a few different teams at MBEC, and all of them are very centered on uplifting community. So there's the research and strategy team where we are like fielding grants from funders, but also doing a lot of research that is community-based participatory research that is really like rooted in like community voices and being community-led, community-driven. There's a policy and advocacy team that works at both the local level, mostly in New Orleans, and then also at the national level, influencing both local and national policy while uplifting those voices. Even our communications team, provides a platform for Black mamas, Black community to uplift their voices, share their stories, change the narrative. We have a really wonderful and growing transnational team that is thinking across borders about how we are uplifting Black birthing and Black maternal child health, really just Black well-being. So there are ways to get involved if you're interested. And I think that MBEC does really value that community voice throughout any kind of work.
Thank you. We have a question in the chat box, looks like from Richard Sussman. So I'm gonna read that out and then jump back to some of our other questions. It says, I would be interested in hearing our excellent speakers talk a bit about how we talk to our young children about these issues. What are the questions we want them to start asking early in their lives so that we can see a change as these young people grow up? In India, maybe you can start us off, and then Tonni.
Rashid, that was an excellent question, and I thank you for bringing it up because the children are our futures, and starting early is the best way. And so I can speak a little bit about the ways in which I approached just nutrition education, sustainable food systems, community food systems in the programming at Mama Toto Village. And that was through education, that was through hands-on practice, workshops, small group classes, literally taking the client and her family to these spaces in the community that offer up, wellness spaces and garden spaces to show them what it's like to have a sustainable community food system in your area, and even teach them how to grow their own food at home through container gardening or small plant potting. So the question or the answer is really just being honest with children, showing them, educating them on the truth of our history, and where we were, where we are, and where we should be. Really being honest about equity and inequities, and how that really plays a role in our outcomes as Black people. And I say Black people because I also identify as Black. And so, that would be my answer. Hands-on experience, education, being honest and truthful about our history as a people, and exposing them to opportunities that would enlighten them on what it means to be involved in community, and what it means to have what it means to grow your own foods and be able to live sustainably as a people. That would be my answer.
Thanks, India. Toni, what about you?
Sure. All of that, India, that is so true. I especially appreciate the be honest with children. When I think about talking to children, what I usually think about is how many times a child asks you why, right?
Yep.
Like why?
Absolutely. Yes.
I say encourage it, right? They want to know why, they want to understand. Let them dig deep into these issues, of course, at their appropriate level, but children are so much more capable, I think, than we give them credit. They want to know why, they want to understand, they want to participate, they want to be active in your family unit or your community unit. So just really just respect the child and let them grow. But I just say encourage them. I don't have children yet. I hope to, but I say I want a wild child who just runs free, that's just let them be free, but teach them the truth.
Absolutely. And I just want to say one more thing to that point, Toni, and allow them to be their authentic self. Allow them to make their own decision and allow them to make their own opinion. We can lead them I'm also not a mom yet, but we can lead them as parents, but ultimately allowing them to make their own decisions and grow into themselves as an individual is key. But that foundation, I want to bring it back to that true change. That foundation is essential. Foundational knowledge is essential.
Yeah, and as a mother, I'm taking this all in because it's so right. There's so many things, but that's a whole nother discussion. We have more questions. So this is an anonymous question, but it says, what kind of policies do you think could be implemented to close the gap on health and food inequities in Black, Brown, Indigenous, and people of color communities? Toni, why don't you start us off?
Okay. What kinds of policies? Sure. Mm-hmm. Okay, so man, there's a lot. I think if you go back to either the beautiful tree that India showed or that web of causation, I think we're going to obviously have to have a lot of policies, because a lot of policies have shaped where we are now. So I'm trying to succinctly think of, okay, implement close the gap on health and food. So if we want to think about food, there are, for example, the farmers bill. There's policies out there that are trying to increase access for Black and Indigenous farmers to have access to land. So thinking about that, I think it depends on, I think all scales are important, but I think we should be thinking about both grassroots and federal level. So if you can enact a community development corporation in your area that can then acquire land and have a land bank where you can then have an urban farm, things like that could be really impactful, while also pushing for policies that increase land access. Or here's a big one. What about if we stop supplementing corn and soy for farmers, for these huge farms, so that that food is not so cheap that it becomes not so appealing for people to get actual food, healthy, real food. That is a big one that has been discussed a lot in farmer communities, where you have farmers who are growing vegetables, but it costs real money and nobody's financing us. But those big farms growing corn and soy are getting a lot of money, sometimes to not even grow corn or soy.
Thank you, Toni. So I'm gonna jump to the next question, and maybe India, you can start us off with this one. It comes from Joyce Clark. Can you give an example on how you could breach the barrier of food deserts in our neighborhoods?
Well, that's a heavy question. And the reason why is because there's so many neighborhoods that face this barrier of food deserts. I'm a Baltimore native and a DC transplant. So I see it across both sectors. The severe barrier of food deserts in neighborhoods that are dense, a huge population. And so for me, the way that I would breach the barrier of food deserts in our neighborhood is really, number one, bringing it back to education, educating the community on their power, right? Because ultimately they are the stakeholders, right? They know what is needed for them and the community that they live in. Encouraging them to get involved on the political level, starting at community levels first, local mayors, community advisory boards, et cetera, and then really teaching them, giving them the tools to be able to advocate for themselves on a grassroots level, because ultimately policy is what changes things. And so if they get out and vote, if they get out and build a relationship with their community members and community leaders, and I mean a relationship, like a conversation, like one that's not rooted in fear, or one that is a two-way street of conversation, like expressing the needs to them and really building that safety net to be able to express the concerns in a way that they feel that the leader will be able to address. I think that would help with a lot of barriers. There's so many things, as it relates to funding and just, space and policy and politics, but I think that, yes, bringing it back to the community, giving them their power, giving them the tools to shape their advocacy grassroots experiences, to really influence their community leaders, to hear them out and fight for them, to eradicate, these food deserts in the neighborhoods of Black communities.
Thanks, India. And I see a question popped up in the chat box. And Tonni, this reminds me of the map that you had shared earlier. And I think some discussion has started around it, but I just wanted to bring it to our attention. It says, what is a food desert? So Tonni, can you start with that? Just describe that for us real quick.
Sure. So a food desert, which now a lot of people are shifting even the language that's used around food deserts towards like food apartheid. But there are areas where, yeah, thanks, Simon. I see someone added it. Areas where there is kind of a confluence, an overlap of people who have low income and do not have access to healthful food. So that would be a grocery store, essentially a grocery store, somewhere you can get fresh produce. And yeah, someone said, we're not counting corner stores. We're counting places that you can go in consistently, you're going to have fresh, healthy foods there. And as was mentioned in the chat as well, the shift away from this description of deserts is because a desert implies that it's like naturally occurring, but food apartheid acknowledges that policies shaped where food is available, and they were racist policies. It would be very clear. And some of the things that India was hitting on too, right? Like the zoning practices that say you have to have so much parking lot space to have a grocery store. Well, if places are densely populated, then they can just say, oh, well, you can't have a grocery store, which really doesn't make sense because there's a bunch of people there who need food. But these policies have shaped where food is available. And that is what food apartheid is.
Oh, thank you, Toni. And there are a couple of questions that have come in that I think are a little similar. And so I'm going to pair them together. There's a couple from an attendant, anonymous attendee says, what should constituents be asking of their representatives as it relates to health and food inequities? And I think that could tie in well with a question around suggestions we might have for getting decision makers to listen. And this particular person goes on to talk about some of the acts and relief acts and things that they're putting into place in New Jersey as an example. So what can we be asking for representatives as it relates to health and food inequities? And then how do we make folks listen to that? Yeah.
I can start really quick with just a brief recommendation. I think, and this brings it back to the conversation about the Farm Act or bill that Toni mentioned. I would say asking for space, asking for resources that allow us to be able to grow our own foods, asking for the dismantling of, structural racism as it relates to financial abilities, and just being able to get financial help for farming, is what I would ask for, is what I would advocate for, because I really want to move more into a space of how our ancestors really provided for their family, and learning those tools, like, growing your own produce, if you choose to have an animal farm, doing that, because that's something that no one can take away from you, that knowledge, that experience, knowing, what you're putting into your body, what the stock of that food is going to be grown from. And so being able to be provided the tools, the space, the resources to make that happen, could really close that gap, I think. Because now you don't have to worry about whether or not there's an accessible food market that has healthy food options in your neighborhood. You can resort to the basic necessities of produce. If you consume animal protein, eggs, etc. And so so that's where I would go towards. I would go towards resources, equipping us with tools to be able to grow our own foods, to be able to build community sustainable food systems, build them out. That's what I would do. That's what I'm passionate about. Yeah.
Thank you, India. Toni, would you add anything to that before?
The only thing I would add is the acknowledgement that every community is different, that you're going to have different assets and different needs. So I would really check in with what's already going on in your community. There might be some momentum that you might not know about. So if you can plug into things that are happening in your community, organize, and be more, I don't want to say organized again, but more direct and more cohesive in your approach, you might have more power in those numbers. So figuring out what exactly is going on locally for you, and then figuring out what your needs are to go forward.
Absolutely.
I think we might have time for one question, maybe one more. And I know there are a lot, so I'm so sorry for all the ones we aren't able to get to. But this one says, what are some things pregnant people and their families can do to ensure better outcomes as it relates to perinatal health? Yeah. India, looks like you might want to start. I get a sense.
Toni, it doesn't matter. You want to start, Toni? Okay. I smile because this is what I'm passionate about. But to go back to the question, is what are some things that pregnant people and their families can do to ensure better outcomes as it relates to perinatal health? First and foremost, if you can find a village, find one. Whether that's family, whether that's community members, whether that's church family, whether that's an organization such as Mama Total Village, find a village, because that is ultimately what is going to help you through this experience, the pregnancy experience. And once again, I'm not a mom, so I can't really relate to this from a personal perspective, but I've seen it through the 300 plus babies that I've, had the pleasure of seeing born and, working with their mom before birth. And so I think that to ensure better health outcomes, I'm gonna speak to it from that perspective. Really working first in the preconception timeframe, addressing nutrition, first and foremost, addressing what we call the wellness wheel, which illustrates holistic wellness and well-being, which addresses your physical, your emotional, your environmental, social, occupational, intellectual, and spiritual health, because these are, once again, those root and foundational components that will help throughout your pregnancy experience. So addressing those things first, gathering your village, and then just living in the experience. But I like to hone in on that wellness piece, because that is what is going to drive ultimately your health outcomes.
Yeah. Tonni, would you like to have a last word, add anything?
I think India said it well. Be well before you are even thinking about pregnancy. Although we know that like this whole like planning isn't really so black and white either, right?
Absolutely.
But just be as well as you can at all points in your life, right? We should be talking about child wellness, infant wellness, not just community wellness, whether or not you're ever going to have a child, right? We just all should be well. And like India said, that whole wheel of wellness is so important. Otherwise, we're off balance. A wheel can't roll if it's not balanced, right? So be whole.
Tonni and India, thank you so much. Thank you for this discussion. Thank you for sharing how your work around equitable food systems and maternal health and justice is really lifting up the dignity, or uplifting the dignity and power of children and families. I think your work is shifting the narrative of what's possible and shaping a future that's really designed for all of us to thrive. And we sincerely appreciate your work. You all are such an inspiration. To our participants, thank you. And I'm sorry in advance for the questions that we didn't get to. There's so many more questions, and my heart is just full with the questions that we have. And so I just want to thank you. But I do have a few quick announcements to share before we leave today. So first is the release of a new tool, a dignity-centered guide to reflecting on cooperative funding structures. This guide is a product of a cooperative design lab group that got together last year to reimagine what it would look like for our communities and coalitions to use cooperative structures to receive and disseminate funding in our communities. So please visit the Now Innovation Forum to download your copy and learn more about this work. Finally, I'm excited to invite you to save the date for this year's National Community Leadership Summit, which will be held virtually October 18th through 19th. So join our newsletter or visit the forum so you can stay up to date on the latest information, including registration and other opportunities connected to the summit. Thank you all for taking the time to join us today. We look forward to connecting with you through the forum, social media, and seeing you soon for the next webinar in this series in June. I invite you to have a wonderful day. Take care of yourselves, your families, your communities, and each other. Thank you so much. It's been an honor and a pleasure. So we'll see you next time. Thanks, everybody.
Thank you, everyone.